Hi, how are you going? I hope you're feeling as well as possible on your medicines. I'm Pharmacist Fi, and this is Denver. Welcome to our Medicine Safety YouTube channel and to this video about medicine interactions of Paxlovid, which is an antiviral medicine to treat COVID-19 infection in people who are at increased risk of hospitalisation or death from COVID-19. This video is to help you understand how some Paxlovid medicine interactions happen, and also to help you to find out the active ingredient names of some of the medicines which interact with Paxlovid. Whereas, if you are looking for a video about how you and your doctor can try to avoid medicine interactions with Paxlovid, please watch my main video about Paxlovid called Part 1. And I'll put a link to my main video into the description section below this video for you, as well as up here. Something else I think I should let you know early in this video is that not all medicines interact with Paxlovid. Paxlovid affects, and is itself also affected by, a wider range of different types of proteins called metabolizing enzymes than most medicines. And each of these metabolizing enzymes helps our body to get rid of certain medicines. And Paxlovid affects and is also affected by certain enzymes in different ways, which means Paxlovid increases the amount of some medicines in our body by slowing down the enzyme that usually gets rid of that medicine, whereas Paxlovid decreases the amount of some other medicines in our body by speeding up the enzyme that usually gets rid of that medicine. And then there are some medicines which increase the amount of Paxlovid in our body by slowing down the enzyme that usually gets rid of Paxlovid. And then there are some medicines that decrease the amount of Paxlovid in our body by speeding up the enzyme that usually gets rid of Paxlovid. And whether the strength of any of these different types of interactions is strong or moderate or mild depends on which medicine is interacting with Paxlovid. And keep in mind that if a medicine level increases in our body, that increases the risk of side effects. Whereas if a medicine level decreases in our body, that increases the risk that the medicine may not work for us. So there are a wide variety of different ways that different medicine interactions with Paxlovid need to be managed. Please also note that the lists of medicines I'm giving you in this video do not cover every medicine that interacts with Paxlovid, because this video is only looking at the medicines in the Australian product information for Paxlovid and the U.S.A.'s prescriber information for Paxlovid and the U.K.'s summary of product characteristics for Paxlovid. As new research comes out, the best ways to manage medicine interactions may change in the coming months or years compared to what is in this video. So, only make medicine decisions with a doctor or a pharmacist or nurse if they are the person prescribing Paxlovid for you in your country, because the person who is considering prescribing Paxlovid for you will be able to look up the latest info to find out if you have any medicine or herbal interactions with Paxlovid, and if so, whether they can be managed or whether Paxlovid needs to be avoided. Please note that these lists of medicines I'll be giving you in this video are active ingredient names. An active ingredient is the part of the medicine that does what the medicine is supposed to do. So if you are unsure of the active ingredients in your medicines or herbal products, your pharmacist will be happy to help you find and write down a list of active ingredient names if you show them your medicine containers and ask them to do this. Let's start by looking at two lists of active ingredients of medicines which, if we were taking them, would mean that Paxlovid must not be taken. This first list is medicines and herbs which stop Paxlovid from working. Even if we stopped the medicines or herbs on this list, we still cannot take Paxlovid because the medicines or herbs on this list would keep interacting for days or in some cases even weeks after we stop taking them. The second list of medicines which, if you're taking any of them, would mean that Paxlovid must not be taken are medicines for which Paxlovid slows down the way our body gets rid of that medicine. So the medicine reaches a higher level in our body. And this is risky because this list of medicines have serious or in some cases potentially lethal side effects if they reach too high a level in our body. So this is why the person who is considering whether Paxlovid may be suitable for you or not really needs you to tell them about every medicine and every herbal product you're currently taking, if you take any of those things, and also everything you've taken in recent weeks as well. Now, this list is combined from lists in the Paxlovid product information available in Australia and the UK and the USA on the 13th of February 2023. Please note that other countries may have slightly different lists, and doctors, pharmacists or nurses should be able to help you to access the latest list of medicines with which Paxlovid must not be taken. This next list is the medicines for which the Australian, UK and or USA medicine information for Paxlovid or the Liverpool University COVID-19 drug interactions checker advise avoiding Paxlovid if the person needs to keep taking one of the following medicines. For some people, not everyone, because this will depend on what medical conditions they have and how severe the medical conditions are. But for some people, some of the medicines on this list might be suitable to stop temporarily or to stop and replace with a non-interacting medicine temporarily so that they can take Paxlovid. But the exact timing of when to stop and when to restart the medicine relative to the dates of Paxlovid treatment will depend on which medicine it is. For example, some medicines may need to be stopped temporarily while Paxlovid is taken, but some other medicines need to be stopped temporarily while Paxlovid is taken and also for 3 days or 5 days after the Paxlovid treatment has ended as well, depending on which medicine it is. And in addition to stopping some types of medicines during Paxlovid treatment and for a certain number of days afterwards, a small group of medicines may also need to be stopped at least 12 hours before Paxlovid is started, or 36 hours before Paxlovid is started, or 72 hours before Paxlovid is started, depending on which medicine it is. So each medicine needs to be checked individually by the person who is considering whether or not to prescribe Paxlovid for you. This next list contains medicines which need increased monitoring during Paxlovid treatment and for a certain number of days afterwards. And the amount of time after Paxlovid treatment depends on which medicine it is and how well a person's kidneys are working. A temporary dose change may also be needed for some of the medicines on this list. Not all of them, but for some of them. And please note that whether a medicine needs its dose to be decreased temporarily or to be increased temporarily will depend on which medicine it is, because Paxlovid affects different medicines in this list in different ways. If a dose change is needed for a medicine on this list, the amount of dose change will also depend on which medicine it is. People taking some medicines on this list would need to be very closely monitored in hospital if they take Paxlovid. For example, the pain medicines fentanyl or hydrocodone or oxycodone, or on an injected anti-epilepsy medicine called midazolam. Other types of increased monitoring include frequent blood tests. For example, for people taking a medicine to prevent blood clots called warfarin, or getting regular ECG monitoring of a person's heart for people taking the antibiotic erythromycin. Monitoring some medicines on this list may be done at home. For example, someone taking felodipine may be advised to immediately report to a doctor if they get low blood pressure or feel dizzy or lightheaded or faint or flushed, or if they get swollen feet or ankles. And please note that even though this list contains medicines for which the Australian, UK and or USA medicine information for Paxlovid advises that increased monitoring is required, really, everyone on any medicine that interacts with Paxlovid should be doing more monitoring of themselves than usual by finding out the key side effects to watch out for, both for any interacting medicines and for Paxlovid, and reporting any side effects immediately to a doctor if they happen. This next list contains medicines which, according to the Australian, UK and or USA medicine information for Paxlovid, are likely to need a dose change temporarily if they are taken with Paxlovid. And please note that these are not the only medicines which may need their dose changed. For example, some of the medicines in the previous list and some of the medicines in the next list we're about to see may also need their dose changed temporarily if they are taken with Paxlovid. This next list is interacting medicines for which Paxlovid's own medicine information advises reading the medicine information of the interacting medicine for advice about how to either manage the interaction or whether Paxlovid may need to be avoided for some people. And this will depend on things like what medical condition the medicine was prescribed for and the person's individual kidney or liver function. Please note that according to the current Paxlovid product information on the 13th of February 2023, Paxlovid should be avoided if someone is taking cyclosporin or tacrolimus, unless extra requirements are met, like immunotherapy specialist advice about dose adjustments and close monitoring of the person's immunosuppressant concentrations and side effects. This brings me to another very interesting thing about Paxlovid medicine interactions, which is that even if two medicines work in the same way or in a very similar way, that does not tell us whether those two medicines do or don't interact with Paxlovid. Because what determines whether medicines interact with Paxlovid is not how they work, but how our body gets rid of them. So this is why each medicine and each herbal product that you take or have recently taken need to be checked by the person who is deciding whether or not to prescribe Paxlovid for you. Some medicines interact so mildly with Paxlovid that they don't need their dose changed. But there is something else to consider for one type of mild interaction. Contraceptive pills and devices containing ethinyl estradiol may not need their dose changed, but they might be less effective during Paxlovid treatment and also for 1 month after treatment has ended. So if the contraceptive pill or device containing ethinyl estradiol is being used to avoid pregnancy, then during Paxlovid treatment and also for 1 month after Paxlovid treatment, another option may be needed, such as an additional type of contraception in the form of a barrier method like condoms or abstinence from sex, or switching to a different hormonal contraceptive pill or device which is not affected by Paxlovid. Those of you who do a bit more research about medicine interactions may already know that Paxlovid has two active ingredients called nirmatrelvir and ritonavir. You may also know that ritonavir is the main active ingredient of Paxlovid, which affects the levels of other medicines. So you might be thinking, why not just stop ritonavir? If ritonavir was stopped, nirmatrelvir would not reach a high enough level in our body for it to work for us. So Paxlovid would not work. So that is why you may have noticed that the way most Paxlovid interactions are managed is to look at the other medicine, which is not part of Paxlovid, and to find out whether any changes can be safely made there or not. I highly recommend watching my main video about how to try to avoid Paxlovid medicine interactions called Part 1. And I also highly recommend watching my video about why everyone should make a medicines, allergies and contacts list and put everything that you take onto it so that you can give it to everyone who helps you with your healthcare, like doctors, specialists, pharmacists, dentists, nurses, and especially make sure that you give it to the person who's considering whether or not to prescribe Paxlovid for you, to help you try and avoid any risky medicine interactions. Please click the subscribe and like buttons below this video if you'd like to see more of these medicine safety videos. And Denver and I look forward to catching up with you again very soon here on this PHARMACIST Fi Medicine Safety YouTube channel. Thanks for watching. Bye.